Hello everyone, welcome to your health today. I am Dr. Olaide Jinadu. We'll be talking about fibroids today. Fibroids are benign. When I mean benign, I mean they are non-cancerous. Benign growths from the uterus. Now when I say the uterus, I'm talking about the womb, the one that you deliver babies through. Now what's the incidence? Above 70% of women about the age of 50 would have developed fibroids. It's a common saying that every woman has fibroids. That is not true. Not all women have fibroids, but most women have fibroids. Fibroids are very common in women of African descent or African American descent. Okay. Now, what are the common causes? Number one cause of fibroids, the honest truth is this: no many causes have been linked to fibroids, but the number one cause is the genetic factor. It is hereditary. If your mother has it as a woman, you're most likely going to have it. Another cause or things that have been linked that have very high risk to fibroids are hormonal therapy, when you take hormonal drugs or when you get pregnant. Now, if you have tiny fibroids, every time you get pregnant, those fibroids get larger. Now, what are the various kinds of fibroids? Now, this will depend on the location of the fibroid. Imagine this being the fibroid, the uterus, the womb. If you have the fibroid on the surface of the womb, it's called a subserous fibroid. If you have it within the muscle, it's called intramural. If you have it within the cavity of the womb, the one that houses the baby, it's called a submucous or submucosal fibroid. If you have a big fibroid loosely attached to the surface of the womb, it's called a pedunculated fibroid. Now, why have I said all this now? Because they will lead us to different signs and symptoms. Now, the various signs and symptoms you might have that might make you want to investigate further are lower abdominal pain, exaggerated bleeding, menstrual flow when you bleed for a very long time. At times, you might not even bleed a lot. Frequent constipation, infertility. Now, there are many other signs, but these are the very key signs that you find. Whenever you go to your gynecologist, he asks you or recommends an ultrasound scan. An ultrasound scan looks at your uterus and actually detects the presence of fibroids. Quick to the solution. Fibroids are majorly treated by surgical procedures. Now, we have various kinds of surgical procedures. Examples of surgical procedures are the open myomectomy, where the lower abdomen is opened up and the fibroids are brought out piece by piece. This is called open or maximum access. Okay, just like doing the cesarean section. We also have the minimal access surgery, where a tiny camera is placed into the navel of the patient and other instruments are placed in to leave little or no scars, to bring out the fibroids in bits and pieces. Now, let me tell you something. For most women in Nigeria, this procedure is not amenable because once you find that you have fibroid, most people discover it late. 1, 2, after discovering it, they procrastinate a lot due to a lot of things they've heard from various people. And in this procrastination, the fibroids get bigger. And the bigger the fibroids, the more difficult it is to do with the minimal access. Now, there are other signs, there are other surgical procedures like the uterine embolization. It means you just try to locate the artery that supplies those fibroids, block the artery, and the fibroid dies out. There are other means that people say, like using of some drugs to try to shrink the fibroids, but these things have not been proven to be very, very effective. Next week, we'll be talking about the various kinds of myths. We've been able to bring together about 14 myths that we're going to break. So stay tuned next week for 14 myths of fibroids that will be broken. Till then, post your comments on this, share, and tag your friends. Thank you very much. Bye.